Welcome back, everybody. And today we're going to be looking at disordered eating patterns and how we can develop healthy relationships with food. So, as usual, we're going to start off with fake or fact. And historically, controlling parents were thought to cause anorexia nervosa, while unstructured, neglectful family relationships were implicated in the development of bulimia nervosa. However, placing the blame on family members is counterproductive in the treatment of eating disorders. Research has revealed that at least 50% of the risk for eating disorders is genetic. Indeed, eating disorders are biologically based mental disorders. Family discord may trigger maladaptive coping mechanisms, but family members can be a vital ally in the treatment of eating disorders. So the answer is fact. And if we look at the media and we look at what's being portrayed as beautiful and ideal, it's far away from what is actually the average. And it sets off this dissonance. We think that this is beautiful and we see what we have and they don't correlate. So, for example, the media's ideal woman is 5 feet 8 inches and less than 120 pounds with less than 18% body fat. And the real average woman is 5 feet 4 inches, 150 pounds with 32% body fat. So there's a big difference there. Even for men, the ideal beauty is 6 feet tall, 140 pounds, with a 30-inch waist and 15% body fat. What's real or average is 36-inch waist and 23% body fat. Also, over time, what we've considered beautiful or ideal has gotten farther and farther away from what we actually are. In the 1950s, your beauty pageant winners were an average of 5 feet 8 inches and 132 pounds. But most recently, they're getting taller and thinner. That means their BMI has gone down, down, and down. And it's not achievable for most people or even healthy. Eating disorders affect over 10 million people. A lot of time they go undiagnosed because people are pretty secretive about their behavior. It could be hard to pinpoint when these things are going on, and it sometimes takes a very long time for people to get help. We know that the earlier we can find an eating disorder, the better the chances of recovery. So we want to try and identify things and as early as possible and get a person to seek help. And I want to point out that we think eating disorders are about food, but it's really not about food. Food is used as a coping mechanism, and really the underlying problem is a psychological disorder. They usually don't exist by themselves, and they usually go along with things like anxiety, depression, obsessive compulsive disorder, those kind of things. And the Diagnostic and Statistical Manual is what the American Psychological Association uses to tell us the classification of eating disorders like anorexia and bulimia. And this tells us, I mean, it was first published in 2013. So that was the in terms of your binge eating disorder. And this tells us that it's actually a really new field. And we're still learning every day about what causes eating disorders and what's the best way to treat them. The first time eating disorders were actually identified as a clinical diagnosis was in 1979. So that's not a very long ago. This binge eating disorders was the third one in the manual and was just delineated in 2013. So it's something that is evolving over time. And there are common eating disorders that we're going to be discussing, which is your anorexia, your bulimia, and also binge eating disorders. And what causes eating disorders? We talked about some psychological factors like low self-esteem or depression. Interpersonal factors also can influence risk. Sometimes if you have an abusive relationship, that could trigger an eating disorder. It could just be a comment at just the right time when you already have low self-esteem. And that one person's comment triggers that. So it could also be social factors like our media portrayal of what is the ideal standards for beauty. Biological factors are now known to be underlying most of our cases of eating disorders. And we used to think it was due to unhealthy family relationships like controlling parents, abuse, or post-traumatic stress disorder. And those things are now known to be triggers for something that's already existing biologically. And the newest frontier looking at eating disorders examine them from both a neurobiological standpoint. And there are changes in brain biology in a person who has an eating disorder. Usually there's a predisposition for it, and then some lifestyle things might trigger it. So it's a combination of different things that are going on. So eating disorders typically develop during adolescence or young adulthood. Think about the images and messages that influence what we think our ideal body should be like, and they start at a very young age. For example, girls are playing with dolls and boys are playing with action figures, both of which have unrealistic body shapes and sizes, which have continued to change over time. And for people who are suffering from an eating disorder, it's really rare for them to be pigeonholed into one diagnosis. And we know that the American Psychological Association, they do have a classification and a diagnostic criteria for your various eating disorders. And sometimes as well, they will, while they do have this criteria, but not all of this criteria can be diagnosed. Sometimes they migrate from one disorder to another over time. It's not as clear. You can't just say, yes, you have this. A lot of people are somewhat along the spectrum, and think of it more as a spectrum than as a specific diagnosis. The diagnosis part is all about insurance reimbursement, honestly, and the way that they develop treatment for them. Even some of the physical effects are very similar among all the different eating disorders. Women do have eating disorders at a higher rate than men, but it's not as much as you might think, especially now that binge eating disorder is classified as an eating disorder. They cut across racial and ethnic barriers. Now we see more and more of this diagnosis across different cultures, race, and ethnicities. Men are not immune to this. The ideal for a man is lean and muscular in the social media world. TV and magazines. Just look at your TikTok, look at Instagram, and how we're kind of bombarded with all various kinds of influencers and the things that they are promoting. And we see that it's not just women, but guys who are trying to look like what they see on social media and TV, especially young guys who are starting to develop their identity. And we talked about this, that whole entire obsession with protein shakes and, building muscles. We can also see in terms of athletes, in sports where with weight classes, it could, disordered eating behaviors can also occur because it gives a competitive advantage over athletes in a lower weight class. And we'll start off with anorexia. And the big deal here is the restriction of energy intake relative to what a person needs. So that person is kind of restricting the amount of calories. And anorexia is a term that means a lack of appetite. And it's used in many aspects of medicine. And sometimes anorexia has nothing to do with an eating disorder. It might mean that a person has a lack of appetite, but anorexia nervosa is a mental disorder. It's not really that they don't have an appetite, it's that they deny their appetite. And when we look at some of these symptoms, we know that binging and purging may exist. For anorexia, some of the physical effects are based not on providing enough nutrients and calories to the body. People with anorexia are often less than 85% of what you would expect for body weight if we were to look at the average. So if we see that low BMI, that would be an alarm. Body fat gets really low. And some of the manifestations of that would be feeling cold all the time and bruising easily because that's not any fat tissue to act as a cushion. We also notice low metabolic rate, which is because they put themselves into that starvation mode, so the thyroid hormone production goes down, and so does the basal metabolic rate. And that might make a person feel tired and sluggish. Feeling fatigue or also fainting is probably due to that low blood volume or low iron status. And it could also be that the heart is not working as effectively. So when a person is in starvation mode, it starts to break down your muscles and your organs. Also, their heart function declines. Iron deficiency anemia, irregular heart rate, and dental decay are all signs. Hair loss is also a manifestation of not getting enough protein or zinc. And we talk about lanugo. It's a fine downy hair that grows all over the body. It's a protective mechanism to get them to a person who's suffering from this to stay warm. And if you see this fine light hair all over the body, that could be a sign that the body fat is getting really low. And other effects, the physical effects we notice is that constipation, which is a gastrointestinal effect, because there's not any food in there, the person can't use the bathroom. There could also be electrolyte imbalances from starvation and imbalances in sodium and potassium, and that could affect the heart function. Loss of menstrual periods, low bone mass, frequent muscle tears or fractures, and injuries could be a sign of not eating enough or fueling properly. The term amenorrhea is a lack of regular menstrual periods. And we talk about how when energy availability is low, reproductive function starts to shut down. And amenorrhea is a sign that hormones that regulate reproductive processes are out of whack. And that is when you have amenorrhea, it's going to affect bone health in the long run. It's not a diagnostic criterion because a lot of people are on birth control that makes them not have period. But for this reason, we can't use amenorrhea as a criterion anymore. For a person that has anorexia, we want to catch it early. The earlier we catch it, the better the chances of recovery. And so the objective basically is to increase food intake, which is obvious. But it's not really about nutrition. And usually a dietitian would also be involved, but it will be a very multidisciplinary team, a team with physicians, nurses, therapists, and dietitians. There's also going to be a group of people working with this person. And then only your nutrition education, it comes a lot later. But first, we need that psychological therapy because the underlying issue is actually a psychological disorder. So we're going to talk about nutrition therapy. And the most important thing is to actually gain cooperation and trust. That's how we're going to get the patient to actually increase their food intake to help raise their basal metabolic rate. And most of the time, we don't have to resort to intravenous feeding. That's only in very extreme cases when the person is on the verge of that. That would be very scary for a person with anorexia because they are afraid of gaining weight. And if you force them to have that intravenous feeding, they're going to freak out. And hopefully it can be gradually through oral food intake. And we also have to, when we think about that idea of what is good food and what is bad food, and this is allowed, that is forbidden, that's actually a very unhealthy relationship with food. And in terms of nutrition therapy, there's always going to be some form of supplementation that's necessary. A balanced multivitamin and mineral supplement will help to replenish nutrients. There's also a big focus on calcium and vitamin D. And bone health will have suffered due to low energy availability and low estrogen. So bone building nutrients need to be replenished. And the goal is try to get them to increase their body mass index to about 20 or higher. And so, some of the goals, like the weekly goals, would be to gain 2 to 3 pounds per week. We can also talk about psychological therapy. The psychological therapy that is common is cognitive behavior therapy and family therapy. Family therapy is great for younger people because it involves the whole family in the treatment. In the past, families have been blamed for their adolescents or young adults eating disorder, and that's not helpful for the recovery and treatment. So getting away from blaming the family for the disorder is a good thing. And when we look at this figure, it shows us that there's an overlap in the physical symptoms of these different eating disorders. We have anorexia, we have bulimia, and we also have that binge eating disorder. And there are some really specific physical effects, but these are the effects that happen when an eating disorder is already in place.